Good afternoon now, it looks like. Thank you all for coming this afternoon. As we all know, this is an unprecedented time in our community, and we know a lot of fear and angst exist around this issue and this virus. We know everybody is afraid of the things that they don't know. I want to assure the public that all of your partners in this community, city and county, our first goal is to protect this community in this county and to assure that people are safe and healthy. We know that there's steps that everyone can take to mitigate and prevent infection. When we hoard necessary items, we're hearing that people are going to the grocery store, they're trying to protect themselves, but hoarding unnecessary items just puts other people at risk. So please listen to the information that you hear from the health department, from the mayor and the county, our county leaders. Make the decisions that are appropriate for you and your family. Number one, please stick to the facts. Don't spread rumors. If you're not sure of a fact, call those of us who have the information. Use the Tulsa Health Department coronavirus website to get information to make decisions for you. Spreading rumors isn't helping the situation whatsoever, and there is knowledge there is power in knowledge. The facts will help you make decisions that protect you and your family. Just as an update, over the weekend we had additional cases statewide, so now we have 10 total cases in Oklahoma. 3 of those are in Tulsa County. All the Tulsa County cases have been travel associated. As part of the standard epidemiological investigations, we have contacted any individuals or settings that may be at risk for exposure. We had Diamond Princess cruise passengers from Oklahoma who have been in federal quarantine. We were able, with the work of many partners, bring them home this weekend, coordinate that very closely with our Tulsa Area Emergency Management. Our local and state and federal partners were extremely important in getting those passengers home. They're now home and safe with their families. They have been screened. None of those patients are symptomatic. They will now be monitored to assure they don't become symptomatic for the next 14 days. On Sunday, Governor declared a state of emergency in all 77 counties, which allow for additional funding in order to provide our hardworking public health officials, healthcare providers, state agencies, and small businesses the ability to unlock additional support and resources as we all respond to COVID-19. Community spread has been identified in Oklahoma over the weekend, and that was identified in Cleveland County. It is likely, in all honesty, that we will detect community spread very soon in Tulsa County. We met with hospital executives in Tulsa this morning to develop a plan to divert individuals from the emergency room for screening. We want to keep healthcare providers safe, as well as making sure those who are high risk safe. We're developing a plan to do screening and testing elsewhere so the hospitals can continue to focus on caring for those who need care the most. We're asking clinicians to use their judgment to determine if a patient has signs and symptoms compatible with COVID-19 and to use their judgment to determine whether that patient should be tested. In the past, prior approval from the Oklahoma State Department of Health was needed to submit specimens. That criteria is no longer required. So labs, we do know that labs are going to start running testing earlier in the day now. State and local epidemiologists now are able to focus on our epi investigations, contact tracing, really focus on our primary goal is finding source and stopping spread. And just as a reminder, testing is not available on site at Tulsa Health Department. If you are concerned about your risk of exposure, contact your healthcare provider. The statewide call center that we've been talking about previously will become available and operational 24/7 later today. Details will be announced as soon, so please watch our social media pages. That number for the statewide call center is 1-877-215-8336. Their call center has the ability to connect callers to Spanish-speaking interpreters. We have continued to review the updated large gathering criteria from CDC and have been in ongoing communication with city and county leaders and will continue to provide guidance from them. CDC's new guidance recommends the cancellation of all public events greater than 50 individuals for the next 8 weeks. We support those guidance. We support the mayor, and we support the county board, and also adhering to those guidances. This recommendation is made in an attempt to reduce the introduction of virus into new communities and to slow the spread of infection in communities which already may be affected by the virus. Additionally, any event which may include 10 or more people who are at high risk for exposure should also be canceled. Events of any size should only be continued if they can be carried out with adherence to guidelines for protecting vulnerable populations, have available hand hygiene and social distancing requirements. When feasible, organizers should modify events to be virtual. This recommendation does not apply to the day-to-day operation of organizations such as schools, institutes of higher learning, or businesses. We do know that all those organizations are developing their own plans to respond to COVID-19. We have been communicating with local schools regarding students, travel, and considerations for closure at this time. There are no new developments. This is a fluid situation. New recommendations from the CDC can be upgraded at any time, which, as you know, which is what's been happening. The outbreak of COVID-19 may be stressful for people throughout the community. Fear and anxiety about disease can be overwhelming, can cause strong emotions in adults and children. Accordingly, we suggest the following recommendations. People with pre-existing mental health conditions should continue with their treatment plans, stay connected with their healthcare provider, and monitor for any new symptoms. Call your healthcare provider if stress reactions interfere with your daily activities. Call the Disaster Distress Helpline at 1-800-985-5990 if you are experiencing emotional distress related to COVID-19. This continues to be a community response. Everyone has a role to play to reduce and slow transmission of COVID-19. Social distancing is one way to prevent the spread of this virus. This means avoiding crowded places and maintaining distance from others when possible. We encourage personal preparedness by bringing hand sanitizer with you, so in the event hand washing isn't available, preventative actions can still be taken. And as always, stay home if you are sick. This is a great time to go for walks with your family, do something creative, and get caught up in your favorite show. Relationships and digital connections are not being canceled. We appreciate our community partners at the city and county levels, as well as the emergency management, as we continue to come together to protect our most vulnerable populations. Now I'd like to introduce Mayor D.T. Bynum.
I want to thank my colleagues from the City Council for being with me today and for all of their assistance and support as we respond to an unprecedented event in our city's history. This morning, I signed a declaration of civil emergency for the city of Tulsa. This will allow us to respond to this event in a more nimble way than we would under normal circumstances, and will expand our ability to be responsive. As part of that declaration, we formalized the limitation of use of city facilities on events of 50 people or more. Those will now be, all special event permits have been revoked moving forward and through April 15th, at which point we'll reevaluate things. And then also any city use of any city facility for 50 people or more for an event is prohibited through April 15th. We've changed that over the last 24 hours. We officially first made this directive on Saturday. The guidance we were receiving from the Centers for Disease Control was 250 people. Yesterday, they updated that to 50 people, and so we have updated our directive accordingly. I want to really thank the different cultural institutions, the churches and religious institutions who followed the spirit of that on Sunday and put the safety and well-being of Tulsans first and foremost on their priority list. We had a number of groups that I know it was hard for them to shut down their events, or for religious institutions to do their services remotely and online. But we know of at least one example, and I'm confident there are probably more out there, where a church doing that saved their congregation from exposure to people who have been around someone who has become a positive test case. This is a great example of why we're doing this in the first place, and I think it's so important for people to understand. The premise behind restricting gatherings of 50 people or more is not in the belief that we can halt contagion on this. The goal of this is to slow contagion on this. What you want to do is have a slow level of contagion so that our healthcare providers who are here, who need to assist those who are most in need of medical assistance, are able to do so. We recognize that the vast majority of people who contract COVID-19 will be able to self-care at home and will get through it and be just fine. But there are another portion of our population who will need significant medical assistance. And if you have a large surge of those number of people that are hitting hospitals all at one time, it really tests the limits of our healthcare system to assist them. And so what we want to do is avoid that by slowing the rate of contagion. And that's the point behind the Centers for Disease Control's guidance, and that's why we're following it so strictly at the City of Tulsa. Also, in line with this guidance, this morning, a group of cultural institutions agreed that they are closing entirely. This includes Gilcrease Museum, the Tulsa Zoo, and a number of other facilities, all of which, the list of which will be provided to you after this meeting concludes. I'm very grateful. I know that it is a challenge for them from a budgetary standpoint to do this, but I am very grateful for them, again, putting the safety and well-being of Tulsans ahead of anything else in their considerations. We're also getting a lot of questions about restaurant operations, looking at what some cities and states around the country are doing. This morning, I sent to Dr. Dart a request that the Board of Health at the Tulsa Health Department meet and provide guidance on attendance at restaurants and bars in the city of Tulsa, and he has agreed to move forward with that. At the City of Tulsa this morning, we are initiating a remote work protocol so that over the last week, we have gone through this and tested it so that any of our employees that are able to work remotely, starting today, they will be doing so. We recognize that thanks to the age in which we live, so many of the services that are provided by the City of Tulsa can be done electronically and remotely, and they will be done moving forward through this event remotely. At the same time, we recognize that there are a lot of our employees, especially first responders, who do not work remotely and can't. And so it is important for me that all of our employees at the City of Tulsa know, and I met with our human resources staff and our legal staff this morning to make absolutely clear that this is the case. Any City of Tulsa employee that contracts COVID-19 in the course of their work will be covered under workers' compensation, under the city's workers' compensation program. Additionally, I signed a waiver this morning that expands the duration of hazard pay for our employees. I don't want any of our employees having to worry about their own livelihood while they're out protecting Tulsans during this event, and we've taken action this morning to make sure that that will not need to be a worry for them moving forward. Along those lines, we have 3 City of Tulsa employees who are currently being monitored by the Tulsa Health Department following contact with individuals who are also under observation for COVID-19. I'm very thankful for the quick action of the Tulsa Health Department to go through their protocols to, one, identify these employees. One is a firefighter, one is a police officer, and one works in our city water department and sewer department. They identified the employees quickly. We were able to isolate those employees and then utilize CDC guidelines to clean any spaces where they might have been and notify any employees or individuals that they may have come in contact. And those 3 employees are now in isolation. I will say, as an organization that has 4,000 employees, that is outward facing and has a job of being out in the community to assist Tulsans, we expect more of this to come. And again, I'm grateful for the support of the Tulsa Health Department in quickly identifying those employees who needed to be isolated and put under a monitoring program, and they are. We're also going to, starting today, initiate a moratorium on any water service shutoffs. At a time when we're asking Tulsans to stay home as much as they possibly can and to be washing their hands as frequently as they can. We don't want them to have to worry about water service to their house, and at a time when our economy is going to be going through such an unprecedented event. And so I've discussed this with the Director of Water and Sewer and with the Tulsa Metropolitan Utility Authority. They are aware of this as well. We will put in place a moratorium on any water service shutoffs during the course of this event. I also want to thank a number of our other utilities, such as Public Service Company of Oklahoma and Cox Communications, for doing this of their own volition. We're proud to follow their lead on this. The municipal courts at the City of Tulsa are also operating under emergency procedures moving forward during this event. Moving forward, if someone has a court date, only that person and their attorney will be allowed into the municipal court, and if they need an interpreter can join them. But larger groups are not permitted in our municipal courts during the course of this event. I've said it before and I will say it again. I cannot speak highly enough of the work that the Tulsa Health Department is doing. As mayor, I get a unique vantage point on the work that they're doing. I don't know when they're sleeping right now. They are working around the clock on a variety of fronts to make sure that Tulsa is properly prepared and properly handling an unprecedented event, the scale of which we probably haven't seen in over 100 years in Tulsa. And so I want to thank Dr. Dart and his team for all of their work. And now I'd like to introduce from the Board of County Commissioners, our partner in all of this, Commissioner Karen Keith.
Thank you, Mayor. This morning, the Board of County Commissioners, in step with the federal and state government, issued an emergency proclamation declaring a state of emergency for Tulsa County. And following consultation with the director of the Tulsa Health Department, who we are leaning on heavily, as is the city, and with other county elected officials, the Board of County Commissioners has made the decision to keep the county's services and facilities open and operating with this time, with the exception, of course, of any events or gatherings of more than 50 people in line with the CDC recommendations. We have instructed our Parks Department to cancel events of 50 or more for the next 8 weeks. Now, Expo Square is also going to follow a similar protocol. And Parks is going to continue to allow golf and tennis. These are self-directed activities. We will continue to monitor this day to day. Now, in regard to the operations of our facilities, we are continuously monitoring evolving issues and community spread. And when that appears in Tulsa County, we will quickly reevaluate and make necessary decisions to ensure the health and safety both of our employees and the public that we serve. This morning, we met with our division leaders and elected officials to discuss plans and preemptive measures that are in place to reduce the risk to the population who is coming into our courthouse as well as our employees. Presiding District Judge William LaFortune is suspending all civil and probate dockets for the weeks of March 16th and March 23rd, and canceling the jury pool calls from March 30th and April 13th, and these will be rescheduled at some time. That is also the case for family dockets, with the exception of emergency custody and protective orders. Now, if you have any questions, you can call the court administrator at 918-596-5400. Again, that's 918-596-5400. Now, the Public Defender's Office is suspending all jail visits. That's both to protect their staff as well as the jail population. And the Election Board is seeking precinct workers in order to protect our older population that normally does those jobs. So they are looking to other locations with limited populations and Expo Square as a good alternative, as well as our community centers in our parks as possible polling places. So if your staff is having to do less work because things are shutting down and you would be willing to allow them to be precinct workers, we're making that offer from among our divisions in Tulsa County. But if you have something similar, they can do video classes to teach folks how to be precinct workers. We want to make sure that these elections go off smoothly. Now, Juvenile is shutting down all public access until further notice. Their court hearings and dockets are going to, at this point, go on as scheduled. And the DA is using electronic filing, and he's working to create video teleconferencing. The county clerk, the assessor, and Tulsa County Inspections welcome the public to do their business by phone, email, or even snail mail. So just trying to cut out that one-on-one contact and keep the numbers down in the courthouse. We advise the public to monitor our website and social media accounts for updates and or changes to our operations. And from all of us at Tulsa County, we want you to stay safe, wash your hands, and we will get through this. We absolutely will get through this because we are all working together as a team, which is what we do here in Tulsa County. And with that, I would like to introduce our Tulsa County Sheriff, Vic Regalado.
Thank you, Commissioner. Good afternoon. As Commissioner Keith stated just a minute ago, I have suspended all visitation to the David L. Moss Justice Center pending further notification. However, we do have the ability for video visitation, and I would encourage all inmates' family to go to our website, tcso.org, in order to establish an account through Tulsa Tech Friends in order to conduct video visitation with our inmates. And again, that will be until further notification. We have also, as of today, suspended all non-critical programs within the jail. And again, that is for the safety of inmates, employees, and of course the public in which we serve. So again, you can go to tcso.org. All the information that we've talked about today in today's press conference is on our website. It also has instructions on how to look up inmates, as well as establishing an account through Tech Friends so that you may have visitation with your family members that may be inside of David L. Moss. You may also call 918-596-8900 during Monday through Friday during work hours, also to speak with somebody who will also be able to provide you with any information in regards to inmates at the David L. Moss. And again, that number is 918-596-8900. Thank you.
I love it here on the floor. The sign that says 6 feet. So it's what we do to protect ourselves. So before we open for questions, just want to remind everybody that all the precautions we're taking are to protect you. You are citizens. You're our responsibility. And as everyone here has mentioned, we've come together to work through this process seamlessly so that at some point life becomes normal again. So at this juncture, can we open up for questions?
The three that you're counting from Tulsa County, does that include the recovered man, or is that an additional third person positive?
3 are the total number of cases, and yes, including the recovered individual.
Is it possible to be reinfected with this stuff once they're recovered? Does it mutate to it?
Frankly, the science is still pretty new. We know that this virus is constantly genetically changing, I would expect next year there's a possibility of a different variation of the virus, just like flu does. As you know, there's different flu strains every year that circulate the globe and in your vaccine. This seems to be playing out very similar to that.
Can you give us a sense of, in terms of the healthcare capabilities, you said you've been in concert with various hospitals, in terms of number of beds, in terms of number of ventilators, do you know exactly what you have at your disposal?
The hospitals have all that information. That's part of why we're coming together to share that amongst all of ourselves, so we know exactly what exists in the entire community. Hospitals have been great. They've been dusting off their pandemic plannings and assure that their infection control protocols are active and working. So we're getting really an asset inventory of all of that. We do know that nationally there's a shortage of things like N95 masks and respirators, but working through that, and that's why we prioritize, so we can protect our most vulnerable until we can resupply as inventory becomes available.
But in terms of specific numbers, in terms of keeping that curve flattened beneath what you're capable of, can you give us any numbers at all on that?
I really don't want to release that because that's a fluid number as well. So.
I know we've had some major revisions over the weekend with the city's plan. Should we consider closing restaurants and bars like other cities have?
So as the mayor mentioned, we're actually calling an emergency meeting of the Board of Health to discuss that. We're trying to get that meeting set. So after that conversation, we'll be happy to answer that question.
Have you all received any kind of indication of any of the new guidelines the feds will release later this afternoon? Have you been given any kind of heads up?
Not yet.
I understand that 2 emergency workers with the city are in isolation now. What's being done to let them know when they're responding to emergencies if someone nearby is in quarantine or someone else is in isolation? How do they know when they're responding?
So as we talked last week, we're asking 911, the operators, to really dig deeper into these calls so that those responders have an idea of what they're responding to. This was a little different situation, and it wasn't a 911 call, but that's what we're trying to do now to protect our first responders.
In terms of the number of people that you're able to test, does that number continue to increase? Do you have a number that you can give us? What's the capabilities of testing at this point?
So I can talk to you about the number of test kits that the state has. I don't know the number of test kits that private labs have. We have 4 private labs who are doing the testing. So state has, over the weekend, they were down to about, I think, between 350 and 400. They're expecting more soon, but we don't know when. And again, I don't know the inventory that our private labs have at this juncture.
What about traveling at the airport? Should anyone expect to see anything different in spring break? Families are maybe going out of state.
I guess I'm not quite sure what you mean by anything different. We know there's been lots of recommendations about travel. A lot of people have not gone on spring break because the events that we're going to have been shut down. We know that airports, when people crowd together, are an excellent place for disease transmission if that occurs, which is why a lot of these events have been shut down. Life at airports now we know are different.